How confident are you in taking a psychiatric history? Psychiatry is often found to be a challenging specialty among doctors. The psychiatric history is essential to gain an understanding of who the patient is, where the patient has come from, and what the patient is currently experiencing. Your approach to the consultation will shape the clinical interview. It is important to create conditions to set the patient at ease. Demonstrating sensitivity and genuine empathy helps in building rapport with the patient. Be respectful and non-judgmental during the consultation. The aim is to build a comprehensive picture of the patient from the earliest formative years to the present. You need to get a grasp of the patient's personality, characteristics, and the relationships with people closest in their life. It is key to encourage the patient to tell their stories in their own words. If you're new to this channel, hi, my name is Dr. Erwin Kwun. I help doctors lead a happy and fulfilling life. I publish new video every Thursday. If you don't want to miss future videos, make sure you subscribe and ring the bell. Today we're going to look at the psychiatric history and risk assessment. I'm going to show you how to take a psychiatric history. First thing first, introduce yourself to the patient. Confirm you have the correct patient in front of you. Check the identifying data. Demographic summary of the patient by name, age, marital status, sex, occupation, ethnic background, and the patient's current living circumstances. Once you have confirmed this information, then you can start with a presenting complaint. The presenting complaint is best documented in the patient's own words. It is a primary problem that brought the patient to the consultation. A patient's presenting complaint can be, I feel I am going mad. I feel low all the time. The next section is history of presenting complaint. We need to gather information to build a comprehensive and chronological picture of the events leading up to the current moment in the patient's life. Ask relevant questions to understand the patient's life circumstances at the onset of the symptom. Ask about precipitating events. Any divorce, being laid off, bereavement, or domestic abuse? Are there any triggers? And how is this impacting on the patient's life? Ask about associated symptoms. Let me give you an example. A 40-year-old gentleman presents with low mood. I may ask, could you tell me when it all started? The open question gives the patient an opportunity to tell their narrative. Listen to the story as it unfolds. I can then ask follow-up questions to gather further information. With mood disorder, it is important to elicit associated symptoms such as anxiety, a lack of energy, a loss of interest, a sense of hopelessness, difficulty with concentration, sleep disturbance, reduced libido, weight loss, and thoughts of death. If the patient is difficult to interview, it might be worth contacting other informants whom you can take a collateral history from, such as family members and friends. Imagine you're asked to see a 17-year-old girl whose mom is concerned about her weight and that she should be eating more. How will you approach this scenario? What do you want to know about the patient? Write down what you want to ask in the comment section. We need to know when it all started. What is her eating pattern like? Quantities and frequencies of eating, reasons for avoiding food. It is important to ask whether the patient is binging, purging, or exercising excessively. We also want to know whether she has experienced menstrual changes. What else do you want to know? Write down what else you want to ask in the comment section. It is crucial to establish patient's ideas, concern, and expectation. This will give you an insight of what the patient is thinking and what a patient is expecting so that you can address their concern. Some patients may be potentially defensive and reluctant to be interviewed. Let the patient know you want to help and understand their problem without giving false reassurances. It is paramount you ensure your own safety, and if you ever feel threatened, to remove yourself from the situation and seek help. A tip to ask difficult questions is to use normalizing statement. Let me give you an example. Sometimes when people want to lose weight, they may take laxatives or diuretics. What have you used to lose weight? By using a normalizing statement, the patient is more likely to open up and answer your question. The information in history of presenting complaint is key in making an accurate diagnosis and formulating the appropriate management. The next section is past psychiatric history. Previous episodes of psychiatric illness and pre-existing conditions are core elements of the psychiatric history. It's helpful to establish dates and length of each hospital admission, treatment given, and follow-up arrangements. The next section is post-medical history. The medical history is important as many medical conditions can cause psychiatric symptoms. Normal pressure hydrocephalus may manifest with dementia-like symptoms. Hypothyroidism or Addison's disease may manifest with symptoms of depression. It's important to know whether the patient suffers with chronic conditions. Patients suffering with long-term conditions are at risk of developing psychiatric problem. We need to know if the patient is taking regular medications. Some medications can cause psychiatric side effects. Corticosteroid treatment may lead to depression, mania, insomnia, and agitation. Isotretinoin may lead to suicidal tendencies. Remember to ask about side effects and compliance to medications. Family history is a core element of the psychiatric history. Ask about the patient's immediate family members. What is the relationship of the patient with each member? Does the patient perceive their family as supportive or difficult? What is the family's attitude and insight into the patient's illness? Does the family have a history of psychiatric illness, suicide, alcohol, and other substance abuse? You want to know the family dynamic. Personal history is a core element of the psychiatric history. You need to inquire about the birth and early life of the patient, school and qualification, whether the patient has achieved higher education. Ask about employment, whether the patient has been an active member of the society, did they enjoy their work, or the patient may never have been employed in their life. Ask about friendship, whether the patient has any friends, any interests. Ask about any significant relationship. Has the patient been married before? Does the patient have children? Ask about psychosexual history. Ask about forensic history. Has a patient had any trouble with the police? If so, you need to inquire what sort of problems. Ask about any use of alcohol or illicit drug. You might not be able to ask all these questions in the personal history. Depending on the consultation, you might want to ask a few of the questions to know who the person is. The next section is premorbid personality. You want to understand the condition of the patient's personality prior to the occurrence of illness. An informant might be a good person to give valuable information to understand the patient's coping style, interests, and activities, and how the individual usually relates to other people. Last but not least is risk assessment. Risk assessment is crucial in psychiatry. We need to assess the risk of suicide, self-harm, and harm to others. Don't be afraid to ask about suicidal thoughts and plan. Be sensitive in your approach. Use normalizing statement. Let me give you an example. Sometimes when people are that down, they feel like they can't carry on. Have you ever felt like you want to end it all? If the patient has suicidal thoughts, you need to inquire whether this is active or passive suicidal ideation. Does a patient have a plan? What is a patient's intent? If a patient is assessed as high risk, admission to a psychiatric unit may be necessary. The risk assessment is important in formulating management and follow-up plan. As you can gather, the psychiatric history has similarities with the medical history. In the psychiatric history, there is more emphasis on personal history, the social history, and risk assessment. If you have been watching until now, thanks for taking the time. I hope you found this video useful. I'm considering making a future video on mental state exam if there's enough interest. Let me know down in the comment section if you want a video on mental state exam. If you like this video, subscribe to my channel where I'm sharing more great videos every week. Thanks so much for watching. Take care everybody. See you in the next video.